Hi, I'm Jen Benke. I'm a psych mental health nurse practitioner, and I'm the owner here at Thrive Integrative Psychiatry and TMS. I've been a psych mental health nurse practitioner for 18 years, and I started Thrive for a couple of reasons. One, because I wanted more time with people. In the regular medical model, at least in my experience, you're booked every 15 minutes, 20 minutes, and it's really just in and out, and you don't have time to really listen and really hear what people aren't saying. And I feel like that's where the relationship builds. That's where the true healing occurs. Also really interested in what else is there besides just medication and counseling, which can be effective, especially together, but they're not always effective. And there's got to be more evidence-based, safe treatment. And so that's how Thrive Integrative Psychiatry and TMS came to be. It's so exciting to me what is coming out now about this idea of the brain's ability to change and adapt, so neuroplasticity, because it means that we're not stuck with our old brain. We're not stuck with our old ways, our old habits, our addictions, our patterns that aren't serving us, that there are ways to change that. So real tangible things can happen in our day-to-day lives by understanding how we can change the brain. TMS stands for Transcranial Magnetic Stimulation. You can think of TMS as rehab for the brain. It's rehabilitating the circuits that become dysfunctional in things like depression, anxiety. I found the research really compelling, and I really wanted to add this to our toolkit, right? So we're still using medication, we're still using therapy, we're still using other evidence-based tools, but I wanted another evidence-based tool, and it's been super exciting to watch the benefit, to watch people recover, just before our eyes. Our North Star is the patient experience. And so we want to treat patients like loved ones. That's our aim, that's our goal. All of our treatment planning is aimed at that. And so while we do have protocols, especially in our TMS program that we follow, we try to make all of our care patient-centered, patient-specific. This is the patient's room. This is their care. They have their own goals. It's our job to work with them toward those goals. That's how we see our role, and to educate them along the way. If you're finding that traditional treatments haven't worked well for you, I would encourage you to keep seeking, keep educating yourself, because there are integrative treatments out there that actually are safe and actually do work. My hope is that you find relief here at Thrive. But if we're not the right next step, we'll help guide you to the next step, the right next step for you. But I've just seen it so many times, people's lives coming back to them, that I would just say keep fighting. Keep seeking, that it's worth the fight. If you're out there and you're struggling, just know that we're here and you don't have to struggle alone. Give us a call, because we'd really love to see how we can help.